Good afternoon, everyone. Thank you for joining us for today's presentation, specifically for healthcare providers who are authorized to treat workers' compensation patients. And today we will be sharing the latest updates on several initiatives that are helping to make the board better for healthcare providers and the workers' compensation system overall. I'm Adam Rossi from the Communications Outreach Unit here at the Workers' Compensation Board. Joining me today is Dr. James Tachi, the board's medical director. Also on hand are Paula Rauch, Audrey Cunningham, Christopher Failing, and Eileen Moss from our medical director's office, as well as Stephanie Zufali, the board's director of regulatory affairs, Tim Purcell, our chief innovative officer, and Dan Giovanangelo, a data analyst here at the board. They will be answering any questions you have today. We do ask that you please make sure your phone lines are muted. We will be using the chat feature to receive your questions today. You can enter your questions throughout the presentation, but please know that we will hold off on answering any questions until the end of this presentation. And again, enter your questions. There's a chat box should be on the right side of your screen. Feel free to enter your questions there. We will answer as many of your questions as we can, but if you have questions that we either don't get to today, or if you think of something after the session ends, we will be providing you with resources at the end of the presentation. So let's go ahead and get started. The board has been working towards making the workers' compensation system better for injured workers, better for businesses, and better for healthcare providers through several modernization efforts that improve stakeholder interactions with our system. We've undertaken several initiatives to improve healthcare and enhance the experience of treating providers. We are making it easier than ever for the board authorized providers to be part of the workers' compensation system. We are truly working to take the comp out of complicated, and as we move into 2023, we want to share our progress with you. Our agenda today includes a brief overview of the board's medical portal, which you will need for access to some of the board's more recent innovative tools. We will then review OnBoard, the board's business information system. Next, we will look at the New York Medical Treatment Guidelines, or the MTGs. We also want to go over some things you should know regarding the implementation of the board's CMS 1500 initiative, which launched on July 1st of 2022. Finally, we would like to remind you of some things you should be aware of regarding workers' compensation in COVID-19. We will then review the additional resources available to you, and again, leave time at the end for your questions. So let's start with the medical portal, which is the gateway to all applications that you will need. The medical portal offers convenient access to trainings, the MTG lookup tool, drug formulary lookup tool, and OnBoard all in one place. The portal also has a link to the XML agreement which providers need to accept prior to sending CMS 1500 forms electronically through a clearinghouse. In order to access the medical portal, you will need to request a board-assigned ny.gov user ID and password. This is not the personal ny.gov ID that you may have with other agencies, such as the Department of Motor Vehicles or the Department of Taxation and Finance. This ny.gov user ID and temporary password will be generated for you by the board when you submit a request for medical portal access. You can request access on the board's website at wcb.ny.gov. Just go to the provider page and select medical portal under the quick link section. When requesting access for the portal, you are required to provide the following information: your healthcare provider NPI. If you're a nurse practitioner, you must request access using your RN license, and you will also need your email address. This should be your individual work email address, not a group or a practice email address. The following types of healthcare providers may request access: acupuncturists, chiropractors, licensed clinical social workers, physicians, physician assistants, nurse practitioners, podiatrists, psychologists, physical therapists, occupational therapists, dentists, audiologists, optometrists, and DME suppliers and labs. If you are a healthcare provider and your specialty is not one of those listed, and you need access to OnBoard to submit a request for decision on unpaid medical bills, which is Form HP 1.0, you will need to request access as a medical supplier. This chart on your screen shows what certain providers can do once they're given access to the medical portal. You can view this chart on our healthcare provider overview page at wcb.ny.gov/medical portal. It is important to keep your information up to date with the board. The board does not distinguish between never authorized providers and those who lapse in authorization. Healthcare providers must renew every 2 or 3 years, and sometimes things change during that time period, such as your address, your phone number, your email, etc. So to update your information, just log into the medical portal. Under the medical provider section, select either new provider authorization request, authorization renewal, or update authorization information. As mentioned earlier, the board is working towards making it easier than ever for board-authorized providers to be part of the workers' compensation system. That's why we are very pleased that the first phase of our new business information system, OnBoard, one of the largest modernization efforts at the board to date, has been fully live since May 2nd of 2022. Use of the new system was rolled out in 3 phases, beginning with submission of prior authorization requests, known as PARs, for medication, known in the system as medication PARs. Today, providers and payers are using OnBoard to request and review prior authorization for medication, durable medical equipment, and treatment and testing. We have hundreds of these PARs successfully flowing through the system each day. More than 47,000 healthcare providers have registered for OnBoard, and more than 31,000 delegates have been added. Since OnBoard first launched on March 7th of 2022, more than 550,000 PARs have been filed. If you haven't already done so, again, we strongly encourage you to sign up for OnBoard as soon as possible. Healthcare providers must use the medical portal to access OnBoard or to renew an authorization, which does require an ny.gov user ID and password for access. The updated medical portal section of the board's website contains full details and information you need regarding how to register and how to get an ny.gov user ID and password to access OnBoard, as well as granting access to others to act as your delegate. Just visit the provider section at wcb.ny.gov/onboard for a guide on registration. So here are a few examples of how OnBoard makes the workers' compensation system easier. It provides increased accuracy, paperless transactions, and a user-friendly interface for interacting with the board. Healthcare providers can now request board action on unpaid medical bills through submission of Form HP 1.0 to ensure accuracy and timely receipt. New electronic submissions of PARs for treatment, medication, and DME. PARs for complicated and/or invasive medical procedures, known as special services PARs, may also be submitted. It eliminates the confusion on which forms to use, and all submissions are automatically routed to the correct party with a time and date stamp, so there are no more wrong fax number scenarios. Please note, the new DME fee schedule became effective with the launch of OnBoard Limited Release, which was back in March of 2022. Assigning delegates, such as your office support staff, can assist you in OnBoard by drafting PARs, which must be reviewed and submitted by the healthcare provider. They can also draft escalations to level 2 medication PARs, which also must be reviewed and submitted by the healthcare provider. They can draft and submit PAR escalations to level 3 for medical director's office review. They can respond to the insurer's request for information, and they can draft and submit Form HP 1.0. Please note, the board strongly advises against a pharmacy employee, a DME vendor, or a medical supplier serving as a delegate of the provider or prescriber to prepare PARs. We believe that for most workers' comp prescriptions, the prescription writing is outside the scope of practice of a pharmacy or a medical supplier or vendor. Moreover, even if it were within the said scope of the practice, we fail to see how the pharmacist or the supplier or vendor would have enough direct knowledge and understanding of the patient's clinical history and status, or direct access to the provider or prescriber to appropriately recommend and or provide medical justification for a PAR. Finally, we believe that such a relationship runs a very real risk of the pharmacy or the supplier or vendor and the provider or prescriber running afoul of state and federal anti-kickback laws. Visit the link on this slide to review a registration guide for healthcare providers. We would like to note delegates cannot do the following. They cannot accept the XML submission partner agreement, register with the medical portal, or report on a provider's status. This chart on your screen labels what submissions certain provider types can make in OnBoard. For example, all provider types listed can submit Form HP 1.0, non-MTG under or equal to $1,000 PARs, and non-MTG over $1,000 PARs. You can view this chart on the provider overview page at wcb.ny.gov/onboard. Once your PAR is submitted, the insurer has a set number of days to respond. Response requirements vary for certain PAR types. Responses for MTG confirmation are required within 8 business days. MTG variants and MTG special services responses are required within 15 calendar days, but the response time is extended to 30 days if an IME is requested. Non-MTG over $1,000 responses are required within 30 calendar days. Non-MTG under or equal to $1,000 responses are required within 8 business days, and medication and durable medical equipment responses are due within 4 calendar days. You can also view this chart on the provider overview page, again, at wcb.ny.gov/onboard. In May of 2022, the board updated existing New York medical treatment guidelines known as MTGs. New MTGs were also added. For any newly authorized providers with us today, here's some quick background on MTGs. Back in December of 2010, the board implemented legislatively mandated MTGs that fundamentally changed the delivery of healthcare to injured workers. The MTGs initially included 4 evidence-based guidelines for the treatment of injuries involving the neck, back, shoulder, and knee. These became the mandatory standard of care for dates of service on or after December 1st of 2010. On March 1st of 2013, the carpal tunnel syndrome MTG and updated versions of the then existing MTGs, including a new maintenance care program, were adopted. The non-acute pain MTG, as well as updated versions of the existing MTGs, were implemented for dates of treatment on or after December 15th of 2014. The following MTGs are effective for treatment as of May 2nd of 2022. Knee injury, mid and low back injury, neck injury, shoulder injury, non-acute pain, ankle and foot disorders, elbow injury, hand, wrist, and forearm injuries, including carpal tunnel syndrome, hip and groin disorders, occupational interstitial lung disease, occupational work-related asthma, post-traumatic stress disorder and acute stress disorder, work-related depression and depressive disorders, eye disorders, traumatic brain injury, and complex regional pain syndrome. You can access full details on these new and updated MTGs, including a PDF of the respective MTGs, on the board's website at wcb.ny.gov. Select Providers on the top of the homepage, scroll down to Resources, and select Medical Treatment Guidelines under the Treatment section. You will also find links to MTG trainings currently available for medical and non-medical professionals. We do want to note that as of December 29th of 2022, these programs are temporarily unavailable for CME credit, but they are expected to resume next month, and the board will announce when the courses for CME credit become available again. Please watch for an update. The non-credit bearing courses are still available, however, and to access the trainings, just visit the board's website at wcb.ny.gov and navigate to the Healthcare Provider section in the middle of the homepage. Select the Medical Treatment Guidelines link. From there, select the training link on the right side of the page. And just a reminder about the availability of the MTG Lookup tool in the medical portal. The MTG Lookup tool allows users to quickly determine whether a particular condition or treatment test combination is recommended, not recommended, or conditional according to the MTGs. When a treatment or test name is selected, the relevant section of the full MTGs for that condition will display. So this online tool will help speed treatment decisions and ultimately provide more effective and efficient care for injured workers. The MTG Lookup tool also has a feature for use by providers that produces a verification summary document in PDF form that confirms the lookup was completed, provides treatment recommendations for that condition, and displays patient-specific case information. This document can be kept by the healthcare provider or attached to any request for service or medical bill being sent to an insurer as verification that the treatment adheres to the recommendations set forth in the MTGs. The MTG Lookup tool is available for all MTGs, and to access the medical portal and the Lookup tool, visit the board's website at wcb.ny.gov. Select Medical Portal from the Online Services menu at the top of the homepage. Another exciting initiative to help streamline processes and reduce paperwork in the workers' compensation system is the board's adoption of the CMS 1500 form. To reduce the administrative burden on board authorized healthcare providers, the board made the strategic decision to consolidate and eliminate certain medical billing forms and transition to using the CMS 1500 form, the universal claim form used by medical providers to bill the Centers for Medicare and Medicaid Services, otherwise known as CMS, as well as health insurers. As of July 1st, 2022, providers must submit the CMS 1500 form. The electronic submission through an XML submission partner is strongly encouraged. As part of the initiative, use of prior medical billing and reports, including the doctor's initial report, Form C4, and the doctor's progress report, Form C4.2, have been discontinued. A full listing of discontinued forms will be discussed later in this presentation. Providers must also prominently report the injured worker's temporary impairment percentage, work status, and the causal relationship of the injury at the top of the CMS 1500 form medical narrative. Payers are required to use the new Notice of Treatment Issue Disputed Bill, Form C8.1B, and notice to a healthcare provider and injured worker of a carrier's refusal to pay all or a portion of a medical bill due to valuation objections, Form C8.4, with applicable claim adjustment reasons codes, known as CARCs, to object to medical bills. Worker compensation payers will electronically transmit the EOBs and EORs to their XML submission partners upon adjudication of the associated electronic CMS 1500 medical bills. Payers are also required to use specific CARCs to their provider EOBs and EORs when objecting to payment of a medical bill, whether the bills are received through an XML submission partner or on paper. Real quick, we wanted to let you know when filing out the CMS 1500 form, please note that fields 4 and 7 are intended to capture the employer's name and address. The board has been receiving forms listing the patient's name and address in these fields, so we just wanted to make you aware of that. Again, if you are not already using the medical portal, you are strongly encouraged to sign up now so you may take advantage of all the online services the board offers, including electronic submission of medical bills to payers and the board. Once you have accepted the terms of the XML submission agreement, you can then discuss details of submission with an approved XML submission partner, also known as a clearinghouse. After logging into the medical portal, providers who have not already signed up for XML submission of the CMS 1500 will see a link for Agreement for XML Submission of CMS 1500 under the Billing section. Select the link and then select the I accept button. The provider's name will be added to the list of providers authorized to submit XML data, which is updated daily, and once accepted, the link will no longer appear when you sign in. We have received several questions about submitting the CMS 1500 form electronically. Here are a couple things you need to know as we make the transition from paper to electronic submission. Electronic submission of medical bills by healthcare providers through an XML submission partner is, again, strongly encouraged. To date, more than 6,700 providers have converted to submitting their bills electronically through an XML submission partner, which equates to about 19% of the medical bill volume. When providers submit CMS 1500 forms electronically through an XML submission partner, the XML submission partner will submit the forms to both the carrier and the board. We'd now like to take a minute to highlight the many benefits of electronic submission. Providers will have confirmation within 7 days that their bill was accepted or rejected by the payer. Providers typically get paid quicker. With acknowledgement of receipt from the payer, the provider is aware that they should not resubmit the bill. Technical errors are identified quickly, so they may be corrected and resubmitted instead of waiting for the payer to deny the bill. For more information, you can visit wcb.ny.gov/CMS-1500, or you can email cms1500@wcb.ny.gov. When the medical narrative template is used, providers must attach a narrative report with clinic visit history examination findings, including the history of the injury or illness, any objective findings based on the clinical evaluation, the diagnosis and assessment of the patient, and a plan of care. The board has developed a medical narrative report template that can be used to create the medical narrative report that accompanies most provider submissions of the CMS 1500 form. Template includes the 3 elements to include with narratives, which is the patient's work status, the causal relationship of the injury or illness to the patient's work activities, and temporary impairment percentage. It is imperative to include these 3 elements to ensure workers receive the treatment and indemnity benefits they are entitled to, and for prompt payment to the provider. It is important to note that certain provider types are not permitted and therefore not required to provide impairment percentages. A medical narrative report may be found legally defective if these elements are missing. However, payers should not use this as the sole basis for non-payment. A PDF of the report can be found at wcb.ny.gov/CMS-1500/requirements, which is under the Medical Narrative Requirements section. For certain types of medical services or supplies, a medical narrative is not applicable. Instead, an attachment is required. So, for example, a radiologist should submit the radiological report with the CMS 1500, and a DME supplier should submit the physician order with their bill. A full list of attachment examples can also be found in the requirements section of the website. As a reminder, the forms shown here on your screen have now been discontinued and are no longer being accepted by the board. It is important to note that Form C4.3 is not being replaced by the CMS 1500 form. Pursuant to Section 12 of the New York Code's Rules and Regulations 325-1.25B1, bills submitted in any other format after July 1st of 2022, including bills submitted on the C4 family of forms, with the exception of Form C4.3, shall not be eligible for an award issued through the medical dispute process under the provisions of the Workers' Compensation Law. Finally, we want to make you aware of the resources we have that we've been sharing with injured workers who believe they may have contracted COVID-19 in the workplace. The board strongly encourages workers to file a claim if they believe they contracted COVID-19 at work. However, the insurance carrier must notify the board of the incident. Workers have 2 years from the onset of illness to file a claim. This is especially important right now because some workers who were diagnosed with COVID-19 in the early days of the pandemic are approaching or have surpassed that 2-year deadline. A positive PCR test is needed for a worker to file a claim. The board has been holding free informational webinars to the public on this topic. Visit wcb.ny.gov/webinars for a list of upcoming presentations to learn more. As we continue to work on implementing improvements for healthcare providers, we're committed to increased communication with providers such as this webinar and targeted email. The board has also created a special webpage dedicated to sharing timely updates on various board's initiatives with a healthcare provider focus. Visit the board's website at wcb.ny.gov and select the Provider Updates quick link on the provider page. We're also committed to regular engagement regarding OnBoard. As primary users of the new system, your input and engagement in the project is very important. On that topic, for more information on OnBoard, please visit wcb.ny.gov/onboard. Resources include a walkthrough of the registration process, video tutorials, and recorded presentations for providers. More information on the CMS 1500 form can be found at wcb.ny.gov/CMS-1500. We also have a dedicated mailbox to answer all your questions on the CMS 1500 initiative. So if you are confused, if things seem too complicated for you, feel free to shoot them an email at cms1500@wcb.ny.gov. If you have provider-specific questions, you can call the helpline at 800-781-2362, or you can email mdo@wcb.ny.gov. You can also find the latest provider updates on the board's website. Visit wcb.ny.gov and select the Provider Updates quick link on the provider page. You can stay informed by subscribing to get board notifications straight to your inbox at wcb.ny.gov. Scroll down to the bottom of the homepage and you'll see a button that says Get WCB Notifications. Click on that and then you get to choose the topics you'd like to subscribe to. You can also follow the board on Twitter, Facebook, Instagram, and YouTube for board news, project updates, trainings, and more. So this concludes the presentation. Thank you for attending. We will now take the rest of your time to answer any questions you have. Again, please just make sure your phone lines are muted. Enter any questions you have in the chat box on the right side of your screen. We do have a number of questions that have already come in, so we're going to take a couple minutes to review those. Our subject matter experts will be on the line to answer those questions that have already come in. I just want to point out real quick, I see a couple questions asking if the PowerPoint will be available and where to find it, or if there's a way to get a layout of the information that was given today. And the good news, we do have a PowerPoint presentation available. We have past presentations available on our website. We will be updating it to include this one. Please make sure you are subscribed for email updates so you know when those are available. We will have the copy of the slide deck in PDF form on our website and a recorded version of this webinar on our YouTube page. So again, just go to YouTube, youtube.com, search for the New York State Workers' Compensation Board, and this webinar will be posted on there, as well as a number of other webinars that you might find helpful. So we strongly encourage you to visit there. Our YouTube page, you'll see it right there on your screen, and take a look at some of the previously recorded webinars we have. For now, I'm going to go back to the MDO information slide, so you have that with you, while our subject matter experts take a look at some of the questions that have already come in, and we will be back with you shortly. Thank you.
Good afternoon. This is Audrey Cunningham from the Medical Director's Office. The first question relates to access to the portal to check the status of a PAR. So that depends on the type of PAR that is submitted and who actually submits the PAR. Right now, the treating provider and or their delegate will be able to check the portal for the status of the PAR. So again, it depends on whether or not the treaty, who actually submits the PAR in terms of who has access to see the status.
Hi, this is Paula, also from the Medical Director's Office. There's a question regarding prescribing MDs that will not submit a PAR for injuries addressed in the medical treatment guidelines. If the treatment is related to a medical treatment guideline body part and the treatment is consistent with the recommendations in the guidelines, a PAR is not required. However, if the treatment deviates from the guideline recommendations, a PAR would be required and the requesting provider must submit it. So if you're having issues with a specific provider who you believe is not following the process, please email the MDO so we can take a look and address it if appropriate. And I believe the MDO mailbox, yep, is up on screen.
Questions regarding submission of the CMS 1500. The first asked specifically whether physical therapists can send their CMS 1500 electronically. The answer is yes, and actually all provider types are strongly encouraged to submit their bills through an XML submission partner or clearinghouse. Adam showed in the presentation the one step that you need to take in advance, which is on the medical portal. You'll just click the button to indicate that you accept the terms of submitting your bills electronically. So again, that needs to be done before you can start submitting electronically. There are now 7 clearinghouses that are approved to partner with the board, and it's likely if your clearinghouse isn't one of those 7, they most likely have a behind-the-scenes type of agreement with one of those 7 so that you'll be successful in getting your bills electronically submitted to all payers. And then there was one additional question regarding a C4.3. Adam mentioned that's not a discontinued form, but that doesn't mean that it may not be submitted electronically. What you can do is submit the CMS 1500 and the C4.3 as the attachment, and that can be sent through your clearinghouse or XML submission partner.
Hi, this is Paula again. So there's a question stating that before recent updates, the PAR entered by the delegate could not be edited by the provider before submission. This is the first that we're hearing of this. If you're still having this issue, I'm going to encourage you to email the MDO with a screenshot of any error messages that you might receive so that we can take a look at that. But this is the first that we're hearing of this issue.
Yes, this is Dr. Tachi. There's a question, will the board be taking into consideration allowing PTs and OTs to submit PARs for body parts previously submitted on C4 forms? There are very few body parts not listed in the MTGs. So the board has heard this request from PTs and OTs. I will say that, we're undertaking several changes, updates, improvements, et cetera, to OBLR. Only so many can be addressed at once, so there's not an immediate plan to do that, but we are aware of that request.
There's a question regarding the first visit for workers' comp cases and whether it requires authorization or not. The initial visit would not require prior authorization. However, once you see the patient, if you determine the course of treatment and that treatment does not meet the criteria and the guidelines, a PAR would be required. In cases where it's a new injury, when you go in to submit the PAR, the system requires that you attempt to do a case search twice. After the second case search comes back, if the case is not found, the system does allow you to move forward manually entering the information. So even if there's not a case assembled at that point, you can still request a PAR.
There's a question regarding whether or not initial visits require prior authorizations, and there are instances where, of course, people don't yet have their number assigned to their claim. So in short, initial visits do not require prior authorization. We appreciate the fact that this especially may be the case in delivering emergent and urgent care.
Hi, there's a question with respect to the submission of the HP1s. And as you know, HP1s are now submitted through OnBoard. And billing delegates as well as providers are able to submit HP1s via the system. I will note there is attestation language upon submission indicating that the medical bill was submitted to the responsible insured and other attestation language.
So this is Dr. Tachi again. There's a question, how long after an accident are the MTGs valid if the patient has not received prior treatment? So generally speaking, in each of the medical treatment guidelines, if you go to the introductory information at the front of each guideline, it'll talk about the acute, the subacute, and non-acute phases of the injury. So the initial phase of the injury or illness, the subacute typically meaning the first 60 days or 2 months, and then the non-acute beyond that. For each of the various conditions and clinical interventions, whether they're diagnostic or therapeutic, it's usually stated when and whether the type of intervention is clinically indicated. If it's indicated in the acute phase, or if it's a later phase intervention, and if it's indicated only after other clinical interventions have been tried. So it's not a matter of how long the MTGs are valid. It depends more on where the person is from their injury or illness onset date and where they are in the clinical course of care. So this is Dr. Tachi again. There's a question. Are emails to the medical director's office regarding MDs refusing to submit a PAR anonymous? So if something is forwarded to our provider compliance committee, we try to, if possible, maintain anonymity. However, more often than not, in order to take action on a specific claim or on a specific complaint, we have to let the provider know who the claimant and who the claim number and what the claim number is. So unfortunately, when a complaint is submitted to the MDO, in order for the complaint to be actionable for us to either help that provider in submitting a PAR or doing whatever the requested action is, we have to give them enough information about the claim or claimant so that they know what we're talking about and we can have them act on it.
Hi, there's a question Asking, formulary medications do not require a PAR as long as following the MTGs and body part is accepted. But if the PAR is submitted for a formulary drug, is it possible for it to be denied? Must it be reviewed as any PAR for non-formulary medication? So if the medication is formulary and the PAR was not required, but it was submitted, you should be reviewing these for medical necessity. So if you feel that it was medically necessary and consistent with the formulary, I'm not sure why it would be denied.
And I would just add to Paula's answer that if a PAR has been submitted for a medication that's on the formulary in the appropriate phase of the formulary and is clinically indicated in the MTGs and it gets denied, then the prescribing provider should escalate that to a level 3 review at the medical director's office, and we'll review it. And if all of those things are true, in all likelihood, approve it. Just as a point of clarification, there's a question that came in that says, who's paying for the first visit that doesn't have an authorization then? And it looks as though, and it's hard to tell, but it looks from the participant name that it may be coming from a physical therapy office. Just to be clear, the answer that we gave earlier was in the context of emergent, urgent care, particularly on the day of injury, et cetera, when an individual may not yet have an authorization number. For the physical therapy, presumably the provider who is prescribing the physical therapy may or may not have submitted a PAR, so you may have an authorization there. And typically, by the time someone gets to physical therapy, they'll have been assigned a claim number for their claim.
All right, we're going to wrap it up here. There are some questions that we weren't unable to get to today. If you want, please, again, email that MDO email on your screen, mgo@wcb.ny.gov. We can look more into things more and get you an answer within a specific time frame. We want to thank you all for joining us today. Thank you to our subject matter experts for taking the time to answer your questions. Again, before we sign off, I would like to remind you to sign up for workers' compensation news via email. Go to wcb.ny.gov, scroll to the bottom of the homepage so I can get WCB notifications. And again, you choose what you want to get from us, so you're not going to be inundated with things that are irrelevant to you. We do also distribute information via social media, so please make sure you follow the board on Facebook, Twitter, Instagram, and YouTube. Again, I strongly encourage you to visit that YouTube page. Along with these provider webinars, we also have a number of other webinars for workers and employers regarding workers' compensation that you might find interesting. And again, do not forget to visit the provider-specific page on our website, where we regularly share updates on what's new and important for providers to be aware of. Just visit wcb.ny.gov and select the Provider Updates quick link on the provider page. Thank you again for joining us today. Please enjoy the rest of your afternoon.